guys, this is Dr. Steph here from Living Health Integrative Medicine, and I'm joining you for a quick Facebook Live because we are getting bombarded with questions and requests for information with regards to how you can boost your immune system during this coronavirus pandemic. And there's a few key things I want to talk about today that are coming out not just in past research, but actually coming out in the media right now as we're speaking with regards to some natural things that even Italy's doing in their hospitals, as well as New York City, and what they're pushing for, and what has been found to be very helpful in the severe cases. So we are able to actually do some of these things on our own right now to prevent and be very proactive and prophylactic with regards to basically protecting ourselves during this time. So there's a lot that you can do. There's so much that you can do that I actually did 2 live webinars that we're going to put the links to both of those replays below. One was a couple hours long. The second one was about an hour and a half. Kind of bombarded everybody with all the things that you could do at home while you're under self-quarantine, or some of the treatments that are still available in some offices that you can do, again, to prophylactically handle things. A lot of really good information about things that you can do that are very natural. I talked a lot about what's happening medically and what's available right now. And then unfortunately, there's just not a lot in between that's given as advice other than wash your hands and possibly wear a mask, which are all good, viable things to do. But as far as nutrients and boosting your immune system, we talked a lot about those. I'm also going to be doing a part 3 because there's some very important updates that are coming out fast and furious right now in the news as this pandemic is spreading and wreaking havoc all around the world. So this Sunday at noon, April 5th, I'm going to be doing another update of what's coming out in the last 7 to 10 days as far as natural things that are being done in the triage centers, in the hospital emergency rooms that are working, that are effective, and you actually have access to doing these things now, even in your own home. So stay tuned for that. We'll also give you the information for that. Right now, I'm going to just do my top 5 nutrients that you should be taking right now. These are the things that Dr. Tom and I are taking. These are the things that our staff are taking right now and all of our patients. So I want to talk about my top 5. And I'm just going to put these numbers here just to make sure I don't forget anything as I'm going through the list. Okay, so first of all, vitamin C. I cannot tell you how many people that we nutrient test in our office that come in with diabetes, autoimmune conditions, just fatigue. They're coming here for weight loss, and they are very low in vitamin C. We are one of the only mammals on this planet that does not make our own vitamin C, and it is absolutely critical. Vitamin C has been shown to have direct antiviral and antifungal properties, meaning it can actually kill things on contact. It also is a very important supporter of the immune system itself as part of our frontline defense. Interestingly, what's coming out in the last couple weeks is that high-dose vitamin C IVs given to severe coronavirus patients in the hospitals has managed to help turn these people around. And I'm sure that's because of its anti-inflammatory effects. It lowers C-reactive protein and some of the inflammation markers that actually takes a severe coronavirus patient out. It's that cytokine inflammatory storm that really knocks people. So if you already are working on this on your own, if you do, worst case scenario, get exposed to the virus, your inflammation is lowered by taking vitamin C every day, then you're going to have less negative effects. And then the other thing we recommend is at the first onset of any type of symptom, whether it's coronavirus or just simple flu or influenza, is that you ramp up to make a dosing for a short period of time in the vitamin C. And then we also have access in our office to high-dose vitamin C IVs. But this is something that you can do at home on your own. Right now I'm recommending about 2,000 milligrams per day, kind of just split dose. Easy on the stomach, and it's really all you need for just right now general prevention and maintenance. The other thing that we find a lot of people low in is vitamin D, in particular vitamin D3, not the prescription D2 that a lot of people are taking. People are walking in very, very low. It's not commonly tested. the most natural way to get vitamin D is via sun, being naked in the sun with no sunblock, which most people aren't going to be doing. And we're coming off, winter, where we've actually been probably depleted because of our lack of sunlight. This is something that we routinely find people low, and the ideal dosing to actually maintain, not even just to get people up to healthy levels, is 5,000 to 10,000 international units per day. This can be done with a liquid, a drop form. That's one of the ones we recommend in our office. That's because it's easy to up and down it depending on your levels. But right now, vitamin D is really, really important. It is an immune balancer. It's an immune support. It does a lot of other things, as well as help with insulin resistance by helping with insulin receptor function. And we know that diabetes and cardiovascular disease is a predictor of a higher risk of death with this virus. So this helps a lot. It's important for brain function, immune function, bone density, and a lot of people are very deficient in it. So vitamin D is number 2. B12 is extremely important for energy cycles and healthy red blood cells, but also healthy white blood cells. It actually increases the number of your frontline neutrophils and macrophages. These are the the white blood cells that are part of your first line immune defense that gobble up bacteria and viruses and invaders. And we want to make sure that we've got good amounts of these guys patrolling the system and we're not very depleted. Again, when we measure patients' blood work when they come in with chronic illness, oftentimes total white blood cell counts are low. Sometimes neutrophils are on the low side, and B12 is one of those things that can be very effective at helping to boost the immune cell numbers. I don't generally recommend that someone just takes 1B all by itself. So the one that we actually have that we recommend right now to our patients is called Active B, and we also have another one called Methylation Plex. Methylation Plex is a combo of B6, B12, B9, B2, and then some other cofactors that help round it all out so you don't become deficient in another vitamin. The next one is called Zinc. Most people are familiar with zinc. You've heard of zinc lozenges. Right now there's been a massive run on zinc lozenges, and they're pretty much sold out everywhere, and there's good reason. We sell it in a zinc lozenge form that's also currently on back order till next week, but we also have zinc capsules. Zinc is another one that we find people actually very low in, and zinc deficiency is partially of our own creation as far as too much processed food and junk food creating mineral deficiencies, but also medications and certain chronic illnesses actually cause zinc deficiency. So we have a lot of people with leaky gut and irritable bowel and gut issues. You end up not absorbing zinc very well. Proton pump inhibitors for gastric ulcers and stomach acid, so Prilosec, things like that are very, very terrible as far as maintaining minerals, especially zinc. So zinc deficiency is very common with those medications, and it's also very common with hypertension medications, diuretics, and blood pressure medications. That's a common side effect of those medications is zinc deficiency. And what we are finding is that in hospitals where they're dealing with very severe COVID-19 cases, I'm talking like deathbed severe, where even in this country they're saying, okay, you're allowed to experiment by using the antimalarial drug hydroxychloroquine. They are pairing it with zinc because the mechanism of that antimalarial drug, it's also known as Plaquenil, is that it actually pulls zinc into the cell, and zinc prevents the replication of the virus. And so really it's the zinc that's important, and you got to have zinc in your system right now, because if you get exposed to any viruses, it's not just COVID that's out there, we still have other things happening that can weaken our system. Zinc is important just day to day because it will help impede and stop viral replication, and that is proven in the research, and it's now being proven on the front lines with this virus. You do not want to overdose this. This is something that it is a heavy metal. It can become toxic, so don't go crazy with it. But we've got a nice zinc capsule that we recommend, just one small zinc a day. And then we have the zinc lozenges. So at the onset of symptoms, or if you're out and about and you have to go grocery shopping and you're immune compromised, you can suck on a zinc lozenge. If you do have the onset of symptoms, there's a way to ramp zinc up high dose temporarily for a small period of time. But again, you don't want to be doing this long term, really high dose, because you can become actually zinc toxic. But critical right now. And in fact, some people in the natural holistic realms are sort of theorizing like, well, what if all this severe stuff that's happening with this virus is actually really zinc deficiency? I mean, can you imagine? So that's an important one. And then this is a big one right here. And thankfully, we just got a huge drop shipment in of this after it was a bit touch and go there for a minute with our supplier. And that's something called monolaurin. Monolaurin is lauric acid extracted from coconut oil in particular. And lauric acid and monolaurin are known in the research to be antiviral, antifungal, and antibacterial without harming the good bacteria. And so it comes in little tiny pellets. And you basically take a scoop of it and you swallow the pellets whole. You don't chew them. They're very bitter. But they have been proven against MRSA, Lyme, HIV even, hepatitis, herpes simplex, candida yeast, and many viruses. And so right now, Manila University in the Philippines is pushing to fast track through a randomized controlled trial to show that since monolaurin has been proven effective against viruses in the past, that it should also be effective against helping with this virus. One of the things that monolaurin does is it pierces the capsule that encapsulates the virus and basically inactivates it. And so that's an important factor as far as that goes in terms of frontline defense. As long as lauric acid is circulating in your bloodstream, you should be able to basically keep the viral loads of any virus down, which again takes the burden off your immune system. So these are the things I'm doing right now. Normal maintenance dose of monolaurin is 1 scoop a day. Right now, just with everything going on, we're actually telling our patients to take minimally 2 scoops a day, or maybe even work up to the full kill dose, so 3 per day. Just build up to that slowly so you don't have a big die-off of something that you might already have in your system, which can cause some short-term fatigue and aches and pains just while your system's trying to clear out a bunch of dead stuff. So just ramp up nice and slowly. These are my top 5. These are the top 5 that are in our basic immune protection bundle on our web store. So we'll put the link for you down there below so you don't have to go sourcing these things in a million places right now, because it's very challenging to find some of these things, as a lot of these things are on back order or they're not going to be available until the end of middle of May or whatever in some stores. So I hope that gives you a little bit of comfort knowing there's some things that you can do to protect yourself, to boost your immune system. This is stuff we've been recommending for a couple decades now for simply just protecting yourself against the flu virus. There's no reason why you can't use these prophylactically and protectively against this particular pandemic. So stay healthy, stay safe, follow the rules, take your supplements, take care of yourself, and we will get through this.